Hi, welcome to episode 7 of Ask Us Anything. I'm Mark Graban, the VP of Innovation and Improvement Services from KaiNexus. Greg, you want to introduce yourself?
I'm Greg Jacobson, the CEO and co-founder of KaiNexus.
So we're going to jump right in. We've got a lot of questions. Isaac asked this question. I've used these types of programs, and I assume he means Lean and Kaizen as we write about it on our blog, and we support through KaiNexus, in a manufacturing environment where programs and schedules are consistent. I don't see it applied as easily in a big box retail environment with varying employee schedules and changing activities. So Greg, let me address this to you. You've always done this in a hospital setting, which is maybe more like what Isaac describes than a manufacturing setting. How have you seen this apply? Are there any particular challenges, or how do you deal with it?
Sure. Well, I think that there's probably two levels to this question. We'll let you address, can the principles be applied to a big box retail? And I'll kind of address more on the tactical side. So that was one of the observations I had when I was reading Miyazaki Imai's book Kaizen back in 2004, which introduced me to all these concepts and principles. And then I immediately realized, wait a minute, we have two emergency departments. We have over 80 physicians. They are in physically two separate places. They are running 24/7, 365. So, how do you connect everyone? How do you allow and facilitate asynchronous collaboration? And how do you make sure that everyone's at the continuous improvement table? And so I immediately reached for technology, recognizing that, there's computers and there are smartphones back, maybe not in 2005, but now today, smartphones everywhere. And it really does create a nice platform to help bring people into the conversation that aren't there. And what we end up seeing is that being able to connect people through that medium ends up facilitating conversations, face-to-face conversations that actually wouldn't have happened without that extra way to communicate, because sometimes a comment's made by someone that maybe is doing a night shift, and someone comes in 15 minutes early on the morning shift to say, hey, Mark, you put this comment in about this. Let's break this down. Can you show me what you're talking about? Can you explain it further? And so I think that's where, when you start getting distributed workforces, whether it's distributed in time or in space, that's really where technology can help kind of put everyone on the same page.
Yeah, and you addressed the Kaizen piece of it perfectly. I would just add, I don't know big box retail environments. I mean, I know there are retailers, restaurants like Starbucks that have been applying lean principles within the stores to do not just to redesign processes, but to try to encourage continuous improvement at the store level. I guess, I would add, I hear, whether it's people in manufacturing or in different settings, they often throw out this objection to say, we don't have consistent demand. We don't have a highly repetitive product or service. I'm like, well, lean is not really about that. The Toyota model of having relatively high volume, relatively repetitive manufacturing is actually, I think, somewhat unusual in manufacturing. You've got a lot of environments where people build custom products. Every product is unique in some way, kind of like the healthcare people would say every patient is unique. And so, you have to, I think, kind of understand what lean is, what it isn't. It's not about just repetition. It's about engaging people. It's about understanding your customer and the value that they need, and kind of applying principles to the right setting instead of making excuses of how we're different than Toyota.
And I think, just to add to that, I think that we hear stories about people applying these principles to their family, to their personal lives. I have been applying these principles to my work day in general. And I think that when you start to see, we're interacting just at KaiNexus with customers in all sorts of different industries. So I don't think that a lean implementation transformation in a manufacturing place is going to look identical to it in, let's say, a professional services. The last webinar we had, professional services. Mm-hmm. But I think that if you understand what the core principles are, you're going to see how they're being applied tactically,
Right.
perhaps slightly different, but the core principles are all going to be extremely, if not identically, the same.
Right. And, if you can't level load demand, the other point I was going to make is that you vary staffing levels accordingly. And we see people in healthcare doing this in emergency departments. Instead of only working 7 a.m. to 7 p.m. or vice versa, they start staggering the shift patterns and kind of addressing the varying demand and planning for that. So next question, what are some of the techniques you found effective in changing the mindset of people whose values, managerial methods, and communication styles are out of sync with what lean requires? Maybe let me address that first. Because this is a big challenge. I don't think we can't get executives to change by telling them to change. I think we need to maybe expose them to other leaders that have embraced lean management styles, that have changed personally, try to maybe help them see what's possible, and maybe try to encourage them just to try making some changes, and then coach them along the way. I think any lean change, any change that happens through lean has to somewhat be learned by doing. It's not just something where you can lecture to somebody and then, they get it and they start acting differently, whether that's reducing batch sizes in a process or leaders changing the way they behave. So I think it can't just involve telling. We've got to kind of try to open people's eyes in different ways. Greg,
I'm going to bring up 3 points because I think this is a really great question. We know that in order to have good continuous improvement, to have a culture, you need the leadership component, the process component, and then the technology component. And the leadership component, what we've ended up finding is probably the most important one. You just can't do this really well without leaders being there. They're all 3 critical, but that's the one that can really kind of knock the stool off. And I took a political science class in college, and it was really interesting. It was called Political Discourse, and the professor who his name escapes me, but it's a class that I've taken I'm talking about a class I took over 20 years ago. And he let us basically argue for half of the semester. It was this 3-hour kind of lab style. And about halfway in the semester, he said, stop. He said, let me ask you guys, has anyone changed their minds about anything? Like, do you understand what anyone's talking about? And we're all like, yeah, no, we really haven't. And he said, okay, so what I want you to do now is I want you to really listen to what the person's saying and to validate what they're saying and really explain that you understand it, and then explain what you're trying to say. Mm-hmm. And that simple, action can really create that connection you need with that leader. So going into the leader and saying, hey, let me tell you how you need to do what you need to do better, that's not going to get anywhere. But if you sit down and listen and say, tell me what your opinions are, what are your principles, what problems are you having, validate those, and then move forward, you're going to come at it with a much better success chance. The second thing I want to bring up is it's a book that I'm reading now. I've been reading it for a while. I've kind of put it down at different stages, but it's Leaders Eat Last. And in Leaders Eat Last, he gets into Simonson. Gets into the biology of what's going on in organizations, and he starts talking about a couple of different hormones. He's talking about or chemicals, I should say. They're not all hormones, chemicals. He's talking about dopamine. He's talking about cortisol, and how those are really powerful chemicals in our body, and how ultimately those are kind of more negative chemicals, or those are chemicals that will end up creating habits that don't foster successful businesses. They certainly have their place. We need cortisol. You need dopamine, but
because cortisol is I guess created when you're under stress.
So if you actually don't have good cortisol responses when you're really sick and are fighting an infection, you can die from that. And so there's a place for it. But the issue is that if you're living in an environment where your cortisol levels are always surging, that's a really big stress on your body, and it's going to create a scenario where you are making decisions that probably aren't good business decisions and good for the organism, if you will. And then he talks a lot about serotonin and oxytocin, which are different chemicals that actually foster trust and foster change, or would, if those were at high levels, people would be more receptive to change. So I recommend reading that book, and I'd recommend thinking about those different chemicals. And those chemicals are actually, I know this is about how do you change leaders, but getting leaders to kind of recognize and you understanding kind of what type of company you're at, I think will give insight. And then the last point I'm going to make is, if you go in to the leader and say, we're going to do a 3-year lean transformation and it's going to involve 18 steps and this and that, and they're going to like glaze over and go, I don't know what you're talking about. But if you just get a small yes, right? Just tell me about a problem, and then let's see if we can work on that problem and just get a tiny little win. It's like the baby steps. Was that Bill Murray? Wasn't there a Bill Murray movie where it was like, yeah, it's all about baby steps. And I think getting a small yes from a leader without putting it in the framework of this is lean or this is continuous improvement or this is Six Sigma, but just we're going to solve a problem. I think you're gonna hear or you're going to find that your audience is a lot more receptive. So.
Yeah, and there's a lot of questions here about it's not about lean methods. It's about change. It's about people. So I'm going to jump. There's a kind of, I think, related question. We can continue this discussion. Ashok asked, how do we convince or show site leadership team of 10 leaders that Gemba walks every day at the same time helps employees on many fronts, that the walk should be for the employees, not the managers, so that they can learn and I kind of paraphrase the question there. So, I mean, I think that's one of those behaviors. A lean leader behavior would be get out of the office, go to the Gemba or the workplace, not to go and not to tell people what to do in the workplace, but to be there as a servant leader and to understand and to build trust. So we could tell a leader it's good to do Gemba walks, or we could try to maybe step back and say, well, what's the problem that a Gemba walk is solving? Because if we're prescribing that for an organization, that's a solution, a Gemba walk in a way. It's not an easy solution, but it's an action to take. So you might want to start in the discussion and say, well, what happens when we stay in our office or when we give people solutions that are cooked up in the conference room? People might reflect on that and say, well, a lot of times we kind of throw out solutions that aren't appropriate and that frustrates people, or kind of understanding what is it that the Gemba walk is a countermeasure to instead of a best practice. And then I think back to your point, Greg, we can't convince them. We can maybe only have them start with baby steps. Go do a Gemba walk. How did that feel? What did that lead to? Are you willing to go and do a second Gemba walk? I think you have to let people sort of discover and learn on their own. It's a progression. It's not a jump from yesterday I didn't do Gemba walks, now today and forever I'm doing them. There's a progression that people have. And
I think even to kind of break that down, even do a smaller yes, maybe you don't even call it a Gemba walk, right? Maybe you're talking about a problem in a conference room and you tell a story about how a conference room solution was made. And I wish I had a good story offhand. Maybe you have one, Mark, where they implemented something because they're sitting in the conference room, but in reality it didn't work. And so just getting people to get up out of that room and go walk to look at the problem in that one tiny case, that's going to be that, and if we're talking about the power of habit, the loop, the routine, there was a cue, there was a routine, and the reward of that action could simply be, actually, we solved the problem. We solved it in a way that we wouldn't have thought about in the room. And then maybe do that a couple more times and then say, actually, right, we could actually do this formally, when we could actually just take this meeting out into the Gemba. Maybe don't even call it a Gemba walk. Call it whatever you want to call it. This is the action of it. But that might be a good first step.
Yeah. And there's a story that, real story I was involved in. It's in the book Lean Hospitals. There's kind of a cover here over my shoulder. In a hospital, I use I think stories are helpful. I don't have data I can point to and say, well, organizations that do Gemba walks are X% more productive, but stories are powerful. There's a story that I tell, long story short, the hospital was trying to improve patient satisfaction scores. And one of the reasons patients were upset was because of noise at night. So quite literally, the CEO from the conference room decided, we're going to carpet the hallways in the patient units. And I was out there in the unit. I was at the Gemba with the nurse manager, and his maintenance crew showed up, and there was a big roll of carpet up against the wall. And the manager in the unit had no idea what was going on. And she walked down and asked, and they said, yeah, we're here to install the carpet. So she wasn't even aware of that change. She hadn't been given any input into that. There were a lot of reasons why carpet would be a bad idea in those units. And so they quite literally rolled out the carpet, pun intended. And it turns out patient satisfaction didn't improve because of the carpet. Patient satisfaction improved because of a lot of little things the nurses and the managers did. They shut doors, they turned off TVs or lowered the volume at night. They were more mindful of their hallway discussions. It was all of those little things that you and I would recognize as Kaizen, driven by the people in the unit, that made an impact, not that top-down solution from the executives. But I think there's dopamine bursts that come from, oh, I've got an answer and I'm going to give that to people. That's one of those habits maybe that we have to try to move people away from. And I tell that story, and people might not have done the exact same thing, but they may recognize a little bit of their own circumstances there and realize, these solutions that are lobbed into the Gemba from the outside don't always work. And we can try a different approach.
That's great.
So we've got another question here. This is Curtis, who asked, maybe this is a short answer. How does pointing fingers at employees, I'm pointing at my camera, how does pointing fingers at employees for the team's mistakes affect morale? One word answer?
Very negatively.
Yeah, badly.
Yeah, okay.
You got 2 words, I got 1 word. I mean, I don't, I'm trying to think, how does blaming people for systemic problems ever help? It doesn't. That's one of those habits that's difficult for leaders to change. When something bad happens, instead of asking who screwed up, who's responsible, to look at the process and to look at systems, that's a change that's easier said than done. Do I blame individuals for blaming others?
I was going to say,
Greg, what do you say?
I always like to apply things to what I'm reading. And so the leaders last would say the blame is you're going to get surges of cortisol, right? Versus looking at that as a mistake and or as a process error, I should say, instead of an individual mistake, you're going to create a burst of serotonin. I mean, that's effectively what that's going to do by kind of thinking through that, and then by solving that problem and making people feel good about the fact that there was a mistake, if you will, not because there was a mistake, but because we recognize that mistakes, for the vast majority of time, actually are just revealing a process problem, which really means that you have an opportunity for improvement sitting right there. And that's all of a sudden, but I can tell you this, and I see this in healthcare. It's one of the main reasons why I got into this as my line of work. When you start pointing fingers, right? We see it on NPR or here on NPR, right? They always, it was the train instructor, the train driver. They just concluded that after a year, it was the train person wasn't paying attention to the road. There wasn't any kind of, and that's all we always, it was the airplane pilot that caused it. And, but when you start having a blame culture, then typically by the time there's a big issue that bubbles up to the leader, there have been dozens, if not hundreds, of opportunities that kind of led to that. We call them near misses in healthcare. And what you end up doing with those near misses is you just keep sweeping them under the carpet. Because if you bring up those near misses, you're going to get in trouble, right? You don't want to get in trouble. And so you end up kind of creating this scenario where there was opportunity to prevent really big things from happening that didn't occur. And not only are you creating a high cortisol, low serotonin environment, but you're setting yourself up for real big safety issues.
Yeah, and I think there's the flip side of the blame game, and there's a lot of human nature and evolution involved in why we tend to oversimplify situations and blame an individual instead of being good systems thinkers. But the flip side to blaming individuals is, I think, the idea that we can prevent problems by just lecturing people to be careful. And so we're going to hang signs in the train engineers station that says, hey, don't stop paying attention. Looking at the sign itself is kind of distracting their attention. But, I've poked fun. It's a serious issue, but I've poked fun for a long time at workplace signs that are meant to prevent safety problems or quality problems, signs that say, be careful, pay attention. I blogged today on leanblog.org about The Simpsons, and there's actually a whole line of workplace safety posters built around The Simpsons and those characters. And I love The Simpsons. I've loved that show from the beginning. But these signs that say, basically, hey, don't trip and fall. I couldn't imagine that those signs really help prevent people from tripping and falling. And the signs may be eye-catching, but I don't think they really work. Or otherwise, we just hang signs in the operating room that say, hey, don't operate on the wrong surgeon
or
the wrong
patient. Instruments inside the belly before you close it up.
Yeah. Be careful. Be careful. Signs. There's a Simpsons sign about washing your hands. Well, people in healthcare know they need to wash their hands. And when they don't wash their hands enough, it's not as simple as saying, well, that's a bad person. There's systemic barriers. And so I think that's the flip side of the blame game. Blaming doesn't help. Like you said, Greg, it encourages people to cover up problems, and just lecturing people or hanging signs. I think if that would have worked in healthcare, it would have worked a long time ago.
I almost wonder if signs about not tripping would increase tripping, because you'd be looking and reading at the sign instead of looking down where you're walking. Anyway, sorry.
Yeah. So, I mean, like at the Toyota plant in San Antonio, they have things posted about good safety practices. And one of them is about, don't walk and text, in the factory. And this is good practice when you're driving or when you're walking as a pedestrian somewhere. The sign itself, the reminder that says don't walk and text, is probably one thing, but I'm sure there's a cultural norm. If somebody were walking and texting, does the plant manager or any employee stop and kind of correct that behavior in the moment instead of ignoring it? Well, I don't want to challenge that person. And then they trip and fall, and then the analysis says, well, it was because they were walking and texting. Shame on them. Like that's not the way to improve safety. We've got to manage these situations, not just hang signs. We hear stories in healthcare. Somebody wrote on my blog last week about pointing out problems, and people said, like, well, no, we can't talk to that surgeon because they're known to have a really bad temper. Well, that's ignoring the problem isn't getting to the root cause, right? And I don't mean to pick on surgeons or doctors there, but all right. Here's another question, I guess a little bit different direction, about change management. A lot of people talk about this. Is there a way of measuring? Is there any measure of the investment that companies are making in that area regarding change management? Which name is this? This is from Mark.
Yeah.
Mark with a C. Any way of measuring the investment that companies make? I mean, I think, I'll think, just kind of, I don't have a good answer to that. I mean, do you measure the number of training sessions and workshops they do about change management? Do you measure the amount of time within a rapid improvement event that's spent on change management practices instead of just observing the process and doing root cause analysis? I think those would be a couple of ways.
Measuring how long it takes to change behavior. I mean, maybe if you're doing change management well, the action that you want to occur at the organization is going to happen in less time than kind of continuing to revert back to the way you did things. Great question. I don't know if there's what they're really trying to say is, how do we prove the ROI that working with management is important?
Yeah, and that's a whole different challenge. The ROI of continuous improvement, the ROI of employee engagement, the ROI of lean. It's not always a direct and easy and simple cost benefit calculation.
I think it's pretty clear, though, if you are interested in EMR is a great example, right? If you're going from paper to electronic medical record, if you don't do change management well, that's going to be a far more painful process than if you do change management well. And that action is an incredibly costly action. I mean, true top-down, massive change is in the organization. If they're done well, is obviously going to. So to me, there's some face validity there, and there's naturally if there is an action that's a strategic action of the company that's really good that are important for that company to make. There is a body of knowledge that can help, if applied correctly, that can help make that transition less painful. So,
right, and it's I think a fair generalization that people really underestimate the amount of effort that needs to go into change management, whether that's launching a new continuous improvement program or a lean transformation, the amount of change management required in an effective rapid improvement event or a bigger project. A lot of times people get focused on understanding the problem, coming up with different solutions. They really, sort of give short change to the amount of communication that is required. So we don't plug things too often here, but maybe as we start to wrap up, I'll plug our KaiNexus user conference, which is going to be happening in Austin in late October. I'm going to be leading an optional workshop on change management. I'm sorry. Early November. It was late October last year. Early November. And people can learn about that at KaiNexus.com. The change management workshop that I'm doing is going to be a day-long exercise where people can get practice with change management tactics, stakeholder analysis, force field analysis, communication plans. And we do it through an interactive web-based simulation, which is kind of a fun way. It's the closest you can get to learn by doing in a setting like a classroom. So, Greg, is there anything else you would want to say about the user conference or anything else that's going on new at KaiNexus these days?
We do have a user conference. It's going to be our second annual. We're really looking forward to it. Check out our website, and you can learn a lot about it. Typically, what we found is that most of our customers are going to come, and then there'll be a smaller segment of folks that are just interested in what we're doing and interested in spreading continuous improvement and interested in learning about companies that are doing that well. So it's open to the public, and it's in Austin. We do it in Austin because a lot of people end up saying, "Oh, I've always wanted to come to Austin," and this is just a great excuse for that. So,
yeah. And if you're interested in that, just do a Google search for KaiNexus User Conference 2016. Google will bring you right to that page. And if you're not a customer, there's possibility of attending as well. And we encourage you to talk to Greg and Jeff and the team at KaiNexus.
And mention on that, Mark, is simply that the user conference is actually it's not a revenue stream for us. So you'll notice that the pricing is really just to cover the majority of the costs. So it's not costing us an arm and a leg. So from a value standpoint, if we're really going to divide quality by price, I would say that our value equation is extremely high when you think about it from that perspective.
Yeah. So. Yeah, because looking back to last year, we had customers giving presentations about their approaches to continuous improvement, what's worked well for them, what are their lessons learned. Yeah, we talk about technology a little bit, but that's just one of the three legs of the stool: methodology, leadership behaviors, and technology. And those are all important. Those are all part of what we talk about at the user conference. So we're about out of time. I guess I'll make a plug for other stuff. Our webinar series, go to KaiNexus.com/webinars. I'll get the date right on this one. June 28th Dr. Mark Jabin, not Mark Graban, but Mark Jabin with the J, is going to be doing a webinar on change and brain science. He's really very knowledgeable, done a lot of research and thinking about this. So it's kind of, I think that'll be a really good thing.
I think if you're,
sign up for
me, and granted, I'm kind of a biology person in general, but for me, if I understand the way things work, I'm able to do better in that action. And Dr. Jabin has really put together a nice story from a lot of the research that he's been reading about and kind of putting together in a cohesive way for us to start understanding what's going on and how do people change their minds and how can you influence people to change their minds. So I think it's certainly especially we had a bunch of questions about change management. It's certainly a great webinar for people to either log into live or sign up for, and then we'll actually send you the video afterwards, and it's also going to show up on our podcast. And we like to put all this content out for the kind of the continuous improvement community, if you will. So fun to be a part of and to grow this body of knowledge.
Yeah. So, all right. So we'll go ahead and wrap up. I think Greg and I will do another one of these in about a month or so. You can get informed about that at KaiNexus.com/webinars. And I want to thank you for taking time to watch the discussion, and thank you for the questions that have been submitted.
Have a great day,
over
guys.
time.